But my main goal is to catch us up 5 minutes. So. You hear me? Yeah. No? Okay. Is that better? Yeah, okay. So, many families in this room will have had a young boy who's been diagnosed as having ALD or a mutation in the ABCD1 gene, will have been diagnosed by a paediatrician, will be being monitored by a paediatrician, and will possibly have had a life-changing and life-altering procedure such as a bone marrow transplant. They will then be followed up. They will be seen every 6 months. You will get to know your paediatricians extremely well. You will trust them. They have saved the life of your young boy. And then your young boy will become a teenager. And at the age of 16, you'll be told, right, off you go into adult services. And many parents and indeed patients will have to be dragged kicking and screaming, I think. And why would you want to move? This person knows all about ALD. This person has saved your child's life. Why can they not keep following you up? They understand you. Why do you have to go back to the beginning? So that's what this talk is about, hopefully to persuade you that we're not so bad, we're fairly normal in adult services, and we will do our best to look after your precious children as they get older. So for us in London, things are not too bad. So this is Great Ormond Street Children's Hospital here, and this is the National. This is Queen Square, where Robin and Lachlan and I work. So you don't have to, all you have to do is walk around the corner. So that bit is very easy. It's not so easy everywhere else. We talk about transition. So rather than being dragged kicking and screaming at the age of 16, we talk about a process over a number of years where young men really are made ready to move across. They're growing up and developing, and they're made ready to move across into adult services. So that should be a planned process that happens over a period of time. And we do that for a lot of chronic conditions because we don't only look after people with ALD, AMN. We have about 300 different metabolic conditions that we look after at the adult centre. So we call this planned process that takes place over a number of years transition, and we call the movement, where you physically move yourself from the paediatric services to the adult services, transfer. So there are two different terms that we use. So transition, in a shorter way of saying it, is transition is the process which prepares the patient and the patient's family for the changes of transfer. So the paediatric services essentially do transition with a little bit of input from the adult services, and the adult services basically do transfer. It's an ongoing process, but overall the aim is that you're developing optimal health for the young person. Where the young person will take on responsibility for their own health, and that ideally they will maintain engagement with health services. So adolescence is a period of time of your life when you are supposed to take risks. That is what it is about. So you're supposed to take risks in adolescence, you're supposed to push the boundaries, you're supposed to try and do things that your parents wouldn't necessarily want you to do. That is completely normal adolescent behaviour.